and it should be booting up now. What I hope most of you can see is kind of the drop-in screen of the website. And so on the last PowerPoint slide, of course, you saw the URL or the pathway that you could find this yourself on the Internet. It's publicly available, and just to highlight it again, it's vizhub.healthdata.org, and then DEX, that's the Disease Expenditure Project that I mentioned earlier. And just as a reference, healthdata.org is the website for the Institute for Health Metrics and Evaluation, where you can find a wide variety of interactive visualizations, much like the one I'll show today. So what we're looking at is the results from that first paper, just understanding the spending on healthcare. This is the kind of descriptive study. And what you're looking at, although you might not know it, is essentially a pie chart. It's just different than the normal pie chart because it's a square. But it's similar to a pie chart in the sense that the larger the box, the more of the spending that we attribute to this type of care. So what you see here is that what we're focusing on is $2.1 trillion. This is personal health care spending that is on an individual, and we're looking at both sexes aggregated together. This is 2013 data that we're looking at, and we're looking at all ages and all causes of illness. And what you see is that the big blue box is ambulatory care, that's outpatient. And you can see that that's roughly 33% of healthcare spending in the United States in 2013, so just above $600 billion. Inpatient care, of course, is the second largest category of healthcare spending, also at 33%, and that's just below $700 billion of spending. And on the right here now you can see the other types of care that we focus on. We look at prescribed pharmaceuticals, which has just below $300 billion in 2013. You have nursing care facilities at just below $200 billion, and then dental and emergency department care, both a little bit more than $100 billion of spending. And when you put all the pieces of the square pie together, of course, you get $2.1 trillion, and that's the total amount of personal health care spending in 2013. What we've really added to the analysis is being able to split this apart by health condition. So now we're looking at the same sort of square pie chart, but instead of splitting out by type of care, we're looking at type of disease. So the big blue bucket is all non-communicable diseases. And so we see right away that about 70% of the $2.1 trillion that we track is on non-communicable diseases, such as cancers and diabetes, mental health, and whatnot. And that, I imagine, doesn't surprise most of us. In the red category, just to make sure we understand what we're talking about, with about 8% of total spending is communicable diseases, and that we also include some maternal disorders and neonatal conditions and nutritional diseases in this category. When we look at international comparisons, which we do some of, you'll see that the red category is much larger, but in the United States, spending on communicable diseases is relatively small. We spend just over $150 billion in 2013 on injuries, and then we track also 4 major risk factors, and we track the spending on those risk factors, and I'll talk more about those in a minute. And then, of course, we know that not all of healthcare spending is just on diseases. We have some well care that includes spending on health conditions that aren't necessarily diseases, but they still involve seeing doctors or nurses or whatnot. And so we see that there's a little bit over $150 billion of spending on well care, and that includes things like preventative dental checkups, maternity care, and pregnancy and postpartum costs. The cost of being born, well newborn care is very expensive as well. So really what we've added is this breakdown, of course, which is kind of interesting, but not as interesting as it could be, until we start to move this granularity bar to start to look at more granular categories. And I'm going to take it all the way to the right here. And now you can see the 155 health conditions that we focus on. So again, we're still looking, the total pie is $2.1 trillion. And what you can see is different categories of healthcare spending. And they're kind of chunked together by like diseases. So the reds are still communicable diseases, the greens are still injuries, the purples are major risk factors and the treatment costs associated with those, whereas the oranges are well care. And one thing to draw your attention to, which really gets to the crux of the issue today, is that is that the darker colors, the ones that pop out to you a little bit more, are the health conditions that have the spending increasing the fastest. So I'm going to start by drawing your attention to diabetes. We found in our study that we spend more in 2013 on diabetes than any other health condition. The total amount is $101 billion in 2013, just spent on diabetes. And that is growing at an annual rate of 6.1%. And so it's an annualized rate from 1996 to 2013, which is really remarkable because this is after controlling for the impact of inflation. So the total health sector as a whole across this time period, after adjusting inflation, growing at about 3.5%. So diabetes spending is going almost double as fast as the health sector as a whole. Another major one that has not only large in the amount at $88 billion, but also growing at nearly double the rate of the health sector as a whole is spending on low back and neck pain. And we can juxtapose this, of course, with some big boxes that have a lighter color, like ischemic heart disease. We see that ischemic heart disease has the same amount of spending as low back and neck pain, $88 billion in 2013, but you can see that the annualized rate is less than 1%. And we'll explore some of the changes and reasons for that in a moment. But it's really important not only to understand the size of the box, how much do we spend as a total in 2013, but then also the growth rate, how these things are changing across time. Some other ones that are really dark are, of course, the treatments of hypertension and hyperlipidemia. In 2013, we spent $84 billion on hypertension, and that was growing at about 5% per year. And if we switch over to high cholesterol, or the treatment of hyperlipidemia, you can see that we spent in 2013 $52 billion, so less total spending. But between 1996 and 2013, we can see the growth rate is at about 10%. So really remarkable growth increases on hyperlipidemia. I'll quick point out a couple different ways we can look at these data. One is what we call a flows diagram, or a Sankey. It's a little bit complicated at first because what we're doing now is we're looking at 3 pie charts instead of 1. If you're looking at this figure, you see that there's essentially 3 columns, and each column is like a pie chart that I showed before, but it's kind of unraveled. And what we see that's kind of magical about the flows diagram is you can actually see how these things are connected. So before I showed you that ambulatory care has about $700 billion of spending in 2013, what we can see with this figure is actually where the ambulatory care spending is going. So you can see that in outpatient care, it's relatively split across all the age groups. And you can see on the right where the spending is going as far as the health conditions. And you can see some of the thicker bars, things like mental and substance abuse disorders, have some fairly large bars, meaning there's a lot of spending in those categories, whereas there's thinner bars in categories like the neurological disorders just above it. Since today's focus is really looking at changes, I thought I'd quick start by looking at diabetes, which is the health condition which has increased the most. So I clicked over here and I type in diabetes, and now this figure is adjusting to focus just on diabetes care. I think this is really interesting. We're still looking at 2013, and we see that in 2013, about 5% of all healthcare spending in the United States was on diabetes. And we can see here that a major piece of that spending in 2013 is on pharmaceutical spending, with an estimated $58 billion of spending just on diabetes, just through pharmaceuticals. And as far as the age groups go, you can see that the largest age category here is 45 to 64 years old. Now, this is interesting because we can roll back the clock and look at 1996, where the healthcare system, as far as personal healthcare spending, was only $1.2 trillion, and diabetes as a whole was just over 3% of the total spending. And if we go now and focus on pharmaceutical spending, rather than having $58 billion spent on diabetes pharmaceuticals, we see $14 billion. And you can see that as we kind of increase time gradually, that there's this major increase in total spending, major increase in total spending on diabetes, and especially a major increase in spending on pharmaceuticals. The screen that I want to end with now is what we call our drivers page, and this is really the most recent research that we're most excited to share today. This figure takes a second to understand, but not unlike the flows diagram, I guess, but really has a lot of information here, so I want to take a second to explain it. What you can see here is the 5 main drivers that we looked at before, that we talked about when I was on the PowerPoint slides. What you can also see is that this is looking at all causes, all health conditions, all ages, and the time period we're looking at spans from 1996 to 2013. And what we're looking, if we go down now to the x-axis, is we're looking at the change in healthcare spending attributed to each driver. So the dot is probably the most important thing. The dot tells us the sum of the 5 factors. So I said before that we have 5 factors that we're looking at that explain the increases in healthcare spending. One is population size, one is population aging, one is the disease incidence and prevalence. The third is the health service utilization, the fourth is health service utilization, and the fifth then is the price and the intensity. And so what you can see in this figure, as I hover over the dot, is that the total increase in healthcare spending between 1996 and 2013 is an increase in $931 billion. What we're doing in this paper and this decomposition analysis is trying to explain what are the factors that led to this increase. And so the total is an increase in $931 billion, but what we're really interested in is what are the drivers. And so we see that population size as a whole led to an increase of spending by about $269 billion. The aging population led to an increase of about $135 billion in spending. Now, if we go over here, we see that there's actually some of the factors that led to a decrease in spending. And so the first of those is actually the incidence or prevalence. And this is kind of interesting. It surprises people at first, but really it revolves around cardiovascular diseases. And between 1996 and 2013 in particular, we've done a very good job, a better job of reducing the incidence and prevalence of many of the major cardiovascular diseases, and in particular ischemic heart disease and stroke. And so because of those major gains in reducing incidence and prevalence of those diseases, we actually spend less on healthcare. The next factor is the utilization, and because we've made gains in essentially limiting the amount of days spent in the hospital, this fourth driver is actually a reduction of healthcare, so it's left of the zero line, meaning it led to a reduction in healthcare spending. And you can see that that there was a reduction in spending of roughly $30 billion due to changes in utilization. And now here the red bar really pops out at you, and you can see that between 1996 and 2013, the annual spending on healthcare increased by about $583 billion because of our fifth driver, the idea of price and intensity. So this is important, but you can see that it's at a very aggregated level. This is all health conditions, all ages, and it's a fairly long time span from 1996 to 2013. What I want to point out now is how we can explore this website in a different way by looking at different categories. So I'm going to add here a split out by ambulatory, inpatient care, prescribed pharmaceuticals, nursing facilities, dental, and emergency department, and I'm going to take away the aggregate, which is the sum of essentially all of those things. And now we can see really distinct patterns across the different types of care. And so for a moment I want to focus on ambulatory care and inpatient care. Both of those, recall I showed you, spend about $700 billion of spending in annual spending in 2013. The increase in ambulatory spending is between 1996 and 2013 was $324 billion, and the increase in annual spending in inpatient spending was about $258 billion. The really important thing is to see the totally different patterns, the way that the factors led to different amounts of increases. For outpatient care, you can see that a lot of the increase is about utilization. And so you see this major increase of about over $115 billion just because of increased utilization of outpatient services. And you can also see that the price of those visits, the intensity of those visits, also went up. But really, when it comes to outpatient, there's this major increase that revolves around utilization. This is really the exact opposite of the story that we see when we look at inpatient care. And this is really interesting that between 1996 and 2013, we've had a major reduction in the utilization of inpatient services. And what that really means is that while admissions have stayed relatively constant, the number of bed days per admission, so the number of days that someone is in the hospital, has actually gone way down. And an easy example that many people are familiar with from their own lives is that if you delivered a baby, say 30 years ago, your number of days in the hospital was 3, 4, maybe 5 days in the inpatient facility, whereas if in 2016 or 17, an uncomplicated labor and delivery, probably in the hospital 1 or 2 days. And so what we've seen is while the admission numbers have stayed relatively constant, the number of bed days per admission, or the number of bed days per sick person, per prevalent case, has gone way down. On the contrary, while the number of bed days per prevalent case has gone down, the price and intensity of care in the inpatient facility has gone up dramatically. And if we go back to that labor and delivery example, essentially what that means is the amount of services and the spending is now just condensed into a shorter amount of time. So the price and the spending has gone up dramatically and led to this major increase. The important thing about our research is that we can see this across all the different types of care. And so you can see pharmaceutical spending has had major increases. A lot of that is because of utilization. Some of it is also because of increases in prices, whereas emergency department increases are really almost fundamentally driven by the increases in price intensity. Last thing I want to show you is that we can look at this by cause. And so again, if we want to focus on diabetes because it's the disease that increased the most, you can click this button and see where the increases in spending on diabetes are. And you can see in the case of diabetes, the major increase is really due to pharmaceutical spending on diabetes. And what we see in the case of diabetes pharmaceutical spending is really a perfect storm. We see that we spend more on pharmaceuticals for diabetes because there's more people, because people are generally older than they used to be, and we know diabetes is prevalent especially in adults and older ages. The prevalence of diabetes has gone up, and this is associated to many risk factors, including obesity, and we see a major increase in spending on pharmaceuticals for diabetes simply because there's more diabetics. The utilization of pharmaceuticals for diabetics has gone up, and the price of those pharmaceuticals have gone up dramatically. And we add all 5 of those increases together, we see that pharmaceutical spending on diabetes has increased alone by $44 billion. So I'm going to switch back to the slides.